Let me share the presentation right now.
Sure, sir.
Okay. So yeah, once again, can you all see the slide?
Yes, sir, we could.
Is it fully visible?
Yes, sir, it is.
Okay. All right. So my topic today what is the RX remote, the role of clinical pharmacist and telemedicine. So yeah, we'll be starting off with session. There's no much to talk. I guess most of you know what telemedicine is. Before that, I want to know what's your idea about telemedicine. Could any of you answer me? What's telemedicine? What do you mean by telemedicine? What do you understand by telemedicine? Could any of you answer that? Hello, is everyone listening to me? Hello. I need one response at least. Can I get a response? Someone.
It's a healthcare services using telecommunications technology through
Okay.
online.
Okay. And have any of you witnessed telemedicine services done anywhere else? Have you had an exposure to telemedicine services anywhere? Okay. Thanks, Ashley, for answering. And also, yeah, Haripriya. Okay. Madhu. We have Madhu. Okay. Any more? Have anyone else experienced telemedicine? Okay. Back to the session. Telemedicine is actually a medical practice where technology is used in healthcare remotively. So, few of the aims where telemedicine's key is easy access to healthcare, convenience, that is to reduce the traveling cost to come to hospital and stuff, and other expenses, and that makes an efficient technological approach to healthcare. So in one sentence, if I explain, it is enhancing patient care through remote expertise. Okay. So if we go through telemedicine history, so it all started back in 1879. So that's when a great personality named Lancet article who approached people, who approached doctors in order to reduce, to reduce unnecessary hospital visits for the patients. And then when we went to 1948, that's where the doctors started discussing radiological findings through the telephones and via other facts and stuff. Then when we come to 1959, that is the University of Nebraska uses interactive telemedicine services, that is the neurological findings according to stroke. So the other day we had Dr. Atul Hari who had explained about stroke, right? So those stroke findings were all those stroke findings were all discussed through telephones and all. So late 60s, that is 1960s, that's when telemedicine department actually established. So telemedicine's like said to be a modern day department. No, but it's not. It's a very old department, which is not that popular these days. Then when we come to 1990s, that's when the internet era started booming up. That's when we start sharing radiological findings, all healthcare data through internet. And when we come to 2009, that is the Center for Medicare and Medicaid Services published its first rule on how to use telemedicine on electronic health records and also other softwares and stuff. In 2014, the National Defense Authorization Act, that is in the US, not in India, note. The US military started accepting telemedicine in the services. So that's the army personnel, when they were in the other countries, they had to use telemedicine services in the US. So that's when they started communicating with the doctors through online video, like face-to-face interaction or videos and stuff. Then when you come to 2016, that is the HRSA, is a government organization, US, allotted 16 billion US dollars to improve telecare services in whole rural communities in US. And when it comes to 2021, that's when the Believers Church Hospital started using telemedicine at its fullest. When we come out to the clinical pharmacist duties in telemedicine, we say we go through medication management. So basically, we do all other stuffs as a CP does in hospital, but a little more. That's it. That is like we don't interact with the patient directly. I mean, face to face. I mean, in life, we interact with patients through online mediums, and it's like we little have face to face. They do have privacy at their home stake and all. I'll be coming back to that. So yeah, we go through medication management. Under medication management, we do the normal stuff, that is medication reconciliation, medication therapy management, medication optimization. We also solve drug allergy issues, managing food drug interactions. And when we come to patient education, we do the patient medication counseling, health literacy. We talk about the diseases to patient, the disease management, and collaboration with healthcare team. That is interdisciplinary collaboration, medication related consultation, treatment plan development. When I divide each three main topics separately, I'll start with medication management, medication reconciliation, as it is as the same duties whatever we do in hospital as a CP. Same goes to medication therapy management. We check with the patients before the consultation is fixed with the consultant. We go through the chart, and that's when we find out any other mistakes with the previous prescription, and then forward with the consultation. Then we have medication optimization. We suggest doctors about the medication optimization. So we we suggest doctors in a sense like there are some drugs, hypertensive drugs, which has to be increased the I mean, which where we have to increase the doses or reduce the doses, like insulin doses and stuff. Then solving drug allergy issues. That is a main thing what we are trying to focus right now here in Believers is to reduce the drug allergies. So Lovely in other hospitals, I'm not sure, but here in Kerala and other hospitals, patients do not get their drug allergies tested or the food allergies tested in prior. So we have come up with an initiative here to test the patient with the drugs and to identify if they have any allergies to drugs, and then we prescribe with an alternative drug here during the IP stay. We're slowly expanding it to the OP admissions, I mean OP consultations too. Then, when we come out to managing food drug interactions, we have collaborated with the diet department, and we have come up with a food drug interaction chart over here. I'm sorry, I'm not having it here right here. I couldn't display it in the PPT, but yeah, the food drug interactions are also one of the major causes in to reduce the drug efficacy. So we have found out various ways to tackle the food drug interactions. Well, we cover to the next topic, that is the patient education, medication counseling. Yes, I'll be explaining. That's where you'll get to know what is medication counseling, how it is done here. Then we come over to health literacy. So that's when patient comes over, the patient talks about some conditions. Before taking a consultation, they do not know which department they have to go to. They start explaining the thoughts, what happened to them, what is the condition of them to us. That's where we decide, we take history of the patient, we analyze the history properly after group discussion with the consultant nearby. I mean, with a random consultant, any consultant, and that's where we decide which department they are allotted. And accordingly, the treatment is done. Disease management, we do that often. Collaboration with healthcare team. So collaboration with healthcare team is one of the initiatives where Believers has taken. That's where the recent collaboration, what must highlight right now is the collaboration with the psychology. So the psychology department and the telemedicine department has collaborated together in order to introduce the telepsychology services towards the rural areas in Kerala. There are very rural areas here where the accessibility to healthcare and hospitals are very low. I mean, people have to travel like 30 to 60 kilometers in order to find a good hospital and get the treatment done. So, to avoid and you know, right? Psychological patients, I mean, psychiatry issues patients don't like to travel more for their treatment, and most of them avoid taking treatments. So that's where we came up in order to start with the telepsychological consultations with patients. So that's where we take history, the psychiatrical issues, the psychiatric medications are reviewed by the CPs here, and after that, the consultation is proceeded to a psychologist or a psychiatrist. There'll be about medication related consultations. So that's where we CPs get to action where we talk to patients about the medication, the use of medication, how to use it, or what dose to be used, what is the areas that can be seen, what can be the side effects, what will be the long-term use, what are the effects on long-term use, what is the urinal output, what happens to when you take a certain medication and stuff. Then we come to treatment plan development. That's where we discuss with the consultants online. I mean, here in person. So actually, the room where I'm sitting right now is a video consultation room. Uh, I don't know how am I able to turn and show you. It's nothing. We have a long, big screen. I mean, a CPU and a monitor. I mean, a keyboard and a mouse, and then we have a camera. So this is where a video consultation happens with consultants and with us and the patient. So we'll be sitting together here, the consultant and the CP, and that here we connect with the patient, and that's when we discuss all this sort of stuff related to consultation. When we come to the next slide, uh, what are the achievements I personally have achieved here? I and my preceders here in telemedicine, my whole CPs have achieved here. As we have reported in 4 years, we have reported 750 plus ADRs. We have counseled more than 2,000 patients here, and Believers Department of Telemedicine, Believers Hospital, has ranked one of the best emerging telemedicine department in Kerala. We mainly do two types of consultations, that is the domestic and international. We do both audio and video, charges are accordingly. In domestic, we do various like landline type of consultations, the message type or the video type or voice messaging type of communication, where one type of communication is to, I mean, we go into patient centric instead of, I mean, we give the privacy at a secured line. And that's when we start asking more and more questions, and the patient starts opening up with a lot of questions and a lot of answers. So when we look at the chart here, the rate of consultations, the rate of doubt regarding drugs here in telemedicine, what we have discussed right now is in the 2021, we have discussed like around 1,000 domestic cases and 10 international cases. That slowly rise to 2024 statistics, that is a 3,852 consultations on drug related and 253 international. The 3,852 is the domestic consultations. When we come out to the international patient treatments, we go beyond India. We go towards the main countries where we find patients approaching us is from the UK, from the Arab countries, and from Singapore, Malaysia, Dubai, African countries and stuff. So we have counseled more than 1,000 international patients at present. As same data has been presented down. What are the benefits of having clinical pharmacists in Department of Telemedicine? To be honest, I had no idea what was telemedicine before joining Believers. And after joining, I was like, okay, this is more like a sort of using technology and stuff, but it is far more. In Believers, staying in Believers, I learned a lot about telemedicine, and I'm eager to learn more. They're like, this is nothing. There's a lot more which is being used in US and UK. Back to topic, sorry. There's improved patient outcomes. We have found much adherence of patient medication adherence. We have reduced ADR and adverse events rate here in Believers, enhanced patient engagement, that is increased patient satisfaction. That's where patients usually come to OPD. They just leave. They'll be in very hurry to get out from the OPD, go back and do their businesses in home or workplace. So most of the patients here and believers miss out patient counseling. They don't come and approach us. So that's where they approach telemedicine, and that's where we start counseling patients about medicines, areas, adverse events, drug interactions, and whatnot. We have also increased health literacy. So we have also started discussing with the patients regarding the health, what happens, what is gonna happen, what might happen if you take this drug, what might happen if you follow this sort of lifestyle. You have to change your lifestyle accordingly and stuff. Then we have increased access to healthcare, care, that is remote patient counseling. Anywhere the patient can approach us. Expand reach to underserved populations. That is, as it spoke, there are a lot of patients here in Kerala that is not able to access healthcare so easily. Then we have reduced healthcare costs. We can reduce the transportation cost. Have you just now, Hainesh had discussed what are the NEVH guidelines, what and all have to be followed. Some of the parts like to take it out. That is, we have to understand patient satisfaction first. What are their needs? And then accordingly, we have to act on it. So when we did a feedback research here, patients were like complaining on like they had to travel a lot. The mental stability is gone once we reach here, and then they have to travel back that like 2 to 3 hours back to the home. So and stuff. Hello, can you hear me? Is there any disturbance? Okay. So we try to reduce that, and we also have reduced the hospitalizations. That doesn't mean business is low in hospital. We are booming business through telemedicine. Then we have optimized medication use. When we go to the next slide, before this, Bharat, that is the RX doctor's head, just asked me what are the AI tools which are being used in telemedicine. I actually did not add those stuff in the PPT because the AI tools which are being used here are few AI tools which are the EMR, the hospital EMR, as built by the hospital IT team. That cannot be shared in our presentations. I'm sorry to say this. Also, the radiological software which is being used in believers is also built by IT team. That is also cannot be shared in the PPT. The lab reports and the lab findings software is also built by the believers team. That cannot also be shared in the PPT. I'm really sorry to say this. Other ports are the Zoom, and we use a software called BitVoice. I don't have it in this system. A software called BitVoice has been installed in our hospital and telemedicine department, which records all the calls. And also, we can do multiple calls to the patients domestically. We can also prompt for an international call to. We have not accessed that yet. We are gonna launch it soon. So BitVoice is a platform where we do the audio consultations. Microsoft Teams and Zoom is a platform where we use it for video consultations. Teams are used for remote access for patients in the rural areas. We have segregated it accordingly. International patients are accessed by Zoom, and the rural areas, we have few projects which have come up here. I'll be explaining about that soon. Few of the studies what our interns and also the CPs here in telemedicine have done here is one of the head publications here in Believers is one maximizing patient care, the crucial role of clinical pharmacists in virtual health hospital and telehealth setting, a review, and a case report on amiodarone-induced toxicity involving in liver and thyroid. So these are like few of the publications which have been published from telemedicine department. So this is the actual view of telemedicine department. On the left, we have a consultant who is checking on how patient walks and how is his motility. It's an orthopedic consultant. On my right, we have the hematology consultant who is doing teleconsultation through his OPD. We connect all the devices in his OPD. Then down, we have two consultants, that is a director and a consultant who is actually doing a consultation over there. This is actually a video consultation. We do not have any pictures of audio consultations. Wait, we do have a CP. This is the one of the CPs who is doing consultation through video. Yeah. Then what are the branches here in Believers we follow under telemedicine is branches of telemedicine is the teleradiology, telepharmacy, telelaboratory, telemedicine, and telepsychology. We are gonna soon start up with other telemedicine services. We'll update you soon in the next icon. Uh, yeah. What are the advancements? What we see here in telemedicine department is one is the academic sessions. Yes. We do have multiple academic sessions held here in telemedicine department. We do have PharmD interns who will be coming here on rotational basis. We have we find rare cases through telemedicine. There will be there'll be patients who come to us first to CPs, and that's when we get to know that this is like one of the rare cases which has been already documented, but it is rare in Kerala or in this hospital. We start dividing those topics. We start having academic sessions on those topics. Then we follow up with the patients, and then we start trending up with the research papers with the interns here. Also, we go with the drug challenges and whatnot. Then we go to rural awareness programs. That's what I said. Okay, first I'll explain the pictures in this slide. The first picture on the left is the MOU signing between our director and the uh, sorry, a rural village, small clinic. So that clinic aims to increase consultations of patients to enclose, not enclose, to reach more patients over there for teleconsultations and to reduce the hospitalizations. So this is a project which is being done here is where patients from a remote area called Chittar, that is a remotest area in Liaway. It's not Liaway. It's 40 to 50 kilometers from this hospital. It's in the jungle, if I was be honest. So that clinic, we had a signed MOU to start with the consultations, teleconsultations, which has to be done quickly here. I mean, teleconsultations take some time, but these teleconsultations are done quickly on spot. The next picture down is something called Everyone Where Everyone's Wearing Blue, is the academic session held by the telemedicine department for the whole hospital in order to increase awareness of telemedicine, also to showcase all what are the testimonies of patients, also to improve, to show them the after effects of telemedicine usage and stuff. Third photo on the left side of the screen as a group photo that is taken after a meeting with one more project of rural services where teleconsultation services are going to be launched soon. That's where we collaborate with each and every department. The blue scrubs is from the PMR department. The pink sari is from the nursing department. And then we have emergency, we have pharmacy, we have lab. So we'll be all collaborating together in order to start a new telemedicine service to this rural area. On to the right of the screen, we have we promote telemedicine services here in our hospital. We improvise patients. We advertise departments, our department logos and stuff in order to reach more patient care. And patients must understand what is telemedicine. So this was a poster done on the National Telemedicine Day last year. Then we come over down as a booklet prepared by telemedicine by our department after I come. This booklet mainly focuses. So the background, what you see is the audio teleconsultation room here in the department, um, and the booklet. The booklet actually focuses on patients, on easy understanding on how the department works, what are the testimonies of patients who have attended telemedicine services, and what happens after telemedicine usage. What are the scopes of telemedicine, how to access it, and how easy it is and stuff. On the notes what I've created, that is we have done with academic sessions, we are done with rural awareness programs, on to next, that is creating in-house awareness. That is what I said. Hospital members must understand what is the use of telemedicine, how to increase telemedicine services, what are the after effects of telemedicine services. That is multiple programs in order to popularize the use of telemedicine services for ease of use among hospital visit patients. Then the next one is the telemedicine collaboration. That is, various collaborative projects with hospitals and clinics are on underway for AI advanced powered services. Oh yes, there are few AI advanced services which are being used on test trials here in Believers as one of the Arca AI program. This is a program where it includes telemedicine and other departments. This is basically where mm, a small device, a ball-like device, I don't have the device right here. A small ball-like device is kept in the OPD. On the doctor's table, there'll be a system. There'll be a patient sitting on the opposite side, and there'll be the doctor here. And a small ball-like structure will be kept in between us. So whatever we talk is being recorded in that small speaker thing, and that is being generated into words into a system. The best part is uh, the Arca AI speaker analyzes the case accordingly and creates a proper management system. Like the doctor just has to review the management system, make some sort of adjustments here and there, and that's it. Voila, the management is done. But we'll have to check accordingly with the lab reports. That is one of the drawbacks what we found from the Zarka AI speaker tool. Um, the other advancements what is gonna come up soon is the collaboration of telemedicine believers Department of Telemedicine with the World Telemedicine. Well, there's a headquarters of telemedicine in the US. We'll be collaborating with them in order to increase the teleconsultations done in here in believers in South India. We'll be also collaborating with Lot Billy Clinics. There is where the MBBS students go for SHPs, that is rural hospitals or the rural clinics, which are found in the lot, mostly a lot. We'll be collaborating with them. One of the drawbacks what we found here in Kerala is most of the doctors don't know how to speak in Hindi or in other regional languages. We are trying to reduce that by clinical pharmacists learning Hindi and other regional languages and improvising like understanding. So become the moderators between the consultants and also the patients. So that is what we are improvising right now. We have started with the collaborations in North India. Let me check if I missed out anything in the slide. Yeah, I was about to say something on the slide, right? Yeah. So how the consultations here in Believers is done is the patient calls us on the landline numbers or the WhatsApp numbers, and we start discussing with the patient on call. What happened? What is the case? Accordingly, we'll be checking on our EMR, what happened to this patient previously, what is the case history, what are the medications they used. On one side, we'll be taking down the history, also the drug history and the food, what is the allergies and stuff. We start analyzing both the history and, recently taken history and the previous history together. We join together and we find out any other mistakes found. We'll also accordingly, hang up on the patient after taking the history. We'll tell them, we'll call them back, and we'll tell them accordingly to text us on a WhatsApp, business WhatsApp, a department WhatsApp number. That's when the patient sends us their hospital number, their name, and which doctor they want to consult, or what is the issue with them on drugs or disease. Uh, we analyze both the issues. We send a copy to the patients accordingly. We try to contact the doctor accordingly and tell them the history of the patient accordingly. And we tell the doctors the changes what we have noticed in this patient, what is the drug changes, how the drug usage has been done by the patient, what is the adherence of the drug, what is the adherence of the patient to the drug accordingly, and we inform the doctors accordingly. The doctors then soon connect the patient through Zoom call. We send the link of Zoom, or the doctors themselves come here for the consultation, and we sit with them, and accordingly we discuss together and then talk to the patient. And if at all the doctors are busy, they reschedule the appointment to the evening and they call back after the OPD asks to the patient. And they update accordingly. And if at all they need to talk to us, if at all they cannot access a clinical pharmacist, they just write down notes on the key sheet. Next year, Bolek, clinical pharmacist comes here. They check each and every case sheets which has been sent by the Department of Telemedicine. We review all the case sheets accordingly. We check for drug interactions. We check for dosage adjustments. We check for drug allergies, drug food allergies, drug food interactions, food allergies too, in accordance with the diet type. Uh, and we also review the case history. And if there are any changes, we consult the doctor again. Personally, we tell them so and so has happened, so and so has seen, noticed. There is a possibility for so and so to happen. The normal CP things. And if the doctor provides us with the evidences, if this is going to happen and stuff, we accept it. Or else the doctor has to make necessary changes and let us know. We will be informing the patient accordingly. We will send them the new prescription and stuff. Also, let me talk about the tele-pharmacy services which have been provided via as the telemedicine services are after the doctor prescribes the medications and case history and the case sheet, we after reviewing, after the clinical pharmacy reviews the case sheet is then sent to the patients. Accordingly, the pharmacy can also access a case sheet in order to produce, in order to give the patients the medications. Once the patient wants the medication from here in the believers, they call the pharmacy on their telephone numbers. That's where the clinical pharmacist present in the pharmacy reviews the case sheet again, reviews the drug chart again, and then approves it, and then it goes to the pharmacist. The pharmacist then arranges the medication. If the patient wants the medication sent to his home, the address is taken and then sent to home. Or the medications are packed accordingly in prior and will be kept stored here. Once a patient comes, the patient has to do the payment online or through the card, and immediately the patient is given the medications. It's done quickly. We make sure that we do not waste the time of the patients, and also we do not make them come here much. We reduce the hospitalizations and hospital visits. Note, everything starts. It's not free of cost because business is business everywhere. Have I missed anything else? I guess that's all for now. Is anyone else having any other doubts on teleconsultations, telemedicine services here?
Yes, so we do have a question.
Okay.
In what ways can telemedicine limitations contribute to misdiagnosis? Could you tell about the limitations and how it could lead to misdiagnosis?
Okay, limitations. One of few of the limitations is patient. We have to make sure we take out the proper history from the patients because there are many patients. We tend to ask reverse questions. So
Sir, actually, you're not audible, sir. We couldn't hear you.
hello, sorry, I'm sorry. Am I
Yes,
audible right now?
yes, sir. Yes, sir. Now you are.
Okay. Okay, so basically, we do not entertain first consultations in departments such as ENT, surgery, uh, endocrine, and stuff because we need to see the patients in person. There's also a service here. That's where the patient shares the sugar reports. I mean the glucose reports. We accordingly give the sugar reports to the consultant after reviewing, and we also suggest the doctors on what doses insulin has to be introduced. The doctor reviews or they listen to our suggestions and they accordingly make a review of that patient. We also provide remote glucose monitoring system that is actually used in every other hospital. I guess I don't have to explain about that. That is, they have a monitor which has been dispensed from here, not from the department. It is dispensed from the endocrine department. That is also use of AI. So that is a monitor which will be placed on your muscles, which reads your sugar levels for 24 hours or 46 hours and gives a reading. That is also called a CGM, if I'm not sure, if I'm not wrong. So continuous glucose monitoring system. That is the one type of AI. So as back to the question, limitations. So there are limitations on patient not discussing us regarding their old histories. That is one of the drawbacks what we find in telemedicine, but we try to maintain. We try to tell the patients to open up more about their medical histories and stuff. Is there any other issues? I mean, any other questions? Here in Kerala, telemedicine services which have been provided as an established department are we have Amrita Hospital, we have Aster MedCity Kochi, then we have Believers Hospital. There are few hospitals, though they do run telemedicine, but in a smaller rates. The biggest telemedicine services which have been provided here in whole India is from the eSanjeevani telemedicine services, that is by the government, which is of free of use. You'll be finding it in Google. And also, we do have telepsychiatry and telepsychological services which have been provided by the Nimans Institute. Uh, they do charge in some consultations, but it is mainly done through video consultations. That is what I've done a research on. I have a friend in Namans who is doing teleconsultations through Zoom and stuff. Is there any other questions regarding telemedicine services? Any other questions? I guess that's it, right? Any other questions? You can put it up in the chat box. I'll be answering it soon.
And we can wind the session. So thank you so much. Thank you so
Okay.
much for your presence.
Okay.
It was really pleasant to hear you, and it was so clear that you made it like an icing on a cake. Thank you so much for your presence. So thank you.
Thank you.
And I hope that it was truly enlightening and newly informative for everybody else. And let's move on to the last session of today's